To the pandemic in this country, the U.S. now reporting more than 140,000 new cases of COVID a day in this country. Tonight here, we're inside hospitals at a breaking point. And Dr. Fauci this evening saying the U.S. could get back to some sort of normalcy by next spring. But what he said has to happen before then. And those new numbers just in from the CDC tonight for fully vaccinated Americans. How quickly does the vaccine begin to wear off over time? ABC's Victor Oquendo from Miami tonight.
Tonight, hospitals in the South buckling under a crush of COVID patients. From Houston, where some ERs have closed their doors, to Louisiana, which marked its deadliest day of the pandemic. Inside Willis-Knighton Hospital in Shreveport, exhausted staff facing a seemingly endless loss of life.
Imagine the pressure of knowing that I don't know if I can do this another day, another hour, but if I don't show up tomorrow, there's nobody here to take care of this patient. There's nobody here to hold this phone and let them talk to their family the last time before we put a tube in them.
Nursing teams locked in a grim cycle, carefully moving the dead from the hospital to the care of funeral homes, only to go right back to the ICU, where they will race to save more COVID patients like this 36-year-old.
It's really hard to see your strong husband be so weak.
Lauren DeBrock, who's recovering from COVID herself, has waited nearly a month for her husband to wake up. Lauren says he wasn't ready to get the vaccine, and she just never found the time.
I made the appointment 3 times and canceled it because I was too busy. If I could go back in time, that is the one thing I would change.
Still, Dr. Anthony Fauci says he sees a light at the end of the tunnel as long as millions more Americans get vaccinated.
If we can get through this winter and get really the majority, overwhelming majority of the 90 million people who have not been vaccinated, I hope we could start to get some good control in the spring of 2022.
Some say the new FDA approval for the Pfizer vaccine helped convince them to get the shot.
Now that there are things that are like FDA approved and stuff like that, that just makes it a little bit more comfortable. For me, I did need to see a little bit more research or just some FDA approval at the very least.
And for the millions of fully vaccinated, that third shot, a booster shot, just weeks away. Officials say it could be available by mid-September. Now, more evidence Americans will need it. An updated CDC study of 4,000 frontline workers found that vaccine effectiveness at preventing any infection dropped from 91% to 66% from April to August, a drop that was likely fueled by the Delta variant surge and a waning of vaccine efficacy over time, especially for healthcare workers who were among the first in the nation to be vaccinated.
And Victor, I want to get right back to that study. And when you see the efficacy waning over time, we should also point out that these vaccines are still very effective against severe disease and hospitalizations. But the numbers are driving the argument for that third shot, a booster shot, which federal authorities say could be available by mid-September.
David, experts stress that while we are seeing more of these mild breakthrough infections, the vaccines dramatically reduce the risk of hospitalization or dying of COVID. Now, there is evidence that the vaccines wane over time, and that's why health officials will recommend a booster shot 8 months after your second dose. David?
Victor Oquendo from Miami tonight. Thank you, Victor.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.